you know that Africa is a very, very big continent.
Yes.
With 1 billion of people, and many disparities between the different regions.
Yes.
South region, East region, Central region, and West region. And the poverty remains in many of these regions. A part of South Africa and also North Africa, most of the countries didn't experience universal health coverage. So difficulty is a reality.
Yes.
And according to diabetes management, some innovation are being used, such as using media, using website application, and so on. But generally, we focus on education.
Okay, good.
Education in local languages.
Of course.
Yes, because most of the patients have a very low level of literacy. This is the main problem. Yes. Past, and in some centers nowadays, we continue to use conversation map. I don't know if you know these techniques.
No.
Conversation maps was an original techniques with photograph, with very, very amazing image, using to adapt the situation of diabetes complications, so that when illiteracy people can look, they can understand the image, because they are not very well in understanding French or understanding education TV broadcast. So this technique is very well. And we also add the education in local languages with different ethnies, because we have quite 30 ethnies in our countries. So with this technique, we arrive to most of people well educated, and we try also to give them some very simple tools to follow blood sugar, and also current method for them and also for their family to have better practice to screen urine, to screen blood pressure, and also to use the insulin or the medication. We can recognize that the WHO is with good partnership with our Ministry of Health in most of African countries. And they try to implement the WUPEN and the WUPEN Plus in the community. So we, with the help of community agents, we try to develop decentralized centers with the minimal of material to help community to work. And as you said, we have only few nurses and limited resources. So the best way to have better practice is to use website applications. Because even if they are not, they have not much money, but many people have a mobile phone.
Yes.
Yes, with this mobile phone, we send message in local languages and they can have access. In the same way, because of limited resources and nurses, we use to implement diabetes management into an NCDs, non-communicable disease. So during the national campaign or the global campaign, for example, campaign to prevent hypertension, campaign to prevent cancer, campaign to prevent cardiovascular disease or to prevent diabetes. Use this campaign to screen every population to cancer, hypertension, diabetes, obesity, and cardiovascular disease. And we use also community agents to join nurses to do this job, this screen correctly to reach many people in these conditions. The situation is becoming better and better because most of Minister of Health or government try to implement universal health coverage, even if this is in a limited country. The hyperglycemic crisis is a very, very, very great problem.
Okay.
Unfortunately, the incidence and the prevalence remain very high. It may reach 50% in most of African countries. And in our different settles, we try as IDF Chair to call for action. This call for action go to find integrated care to try to have a rapid screen of this complication and to explain to diabetic patients to have finger stick glucose and glucometer, and also to contact the hospital when they have polyuria, polydipsia, or they are fatigued. So the second way is when we receive a patient and we put in place treatment. After the treatment, we implement a good strategy of education to avoid recurrence of hyperglycemic crisis. Unfortunately, most of these complications appear in young people.
Oh, sad.
Young people. So many of them, unfortunately, died. But we try to train pediatric endocrinologists to implement this management in every setting, in every countries, and I think that it's become more and more explore, and we start to have better results in this condition.
I'm sure.
But the challenge remain a challenge in our condition.